One of the major challenges in the healthcare industry today is the ability to strike a balance between business efficiency and taking the time to provide needed bedside manners. Research shows that 93% of human communication is nonverbal, or what may be understood as body language. Considering this fact, how can any book or training material attempt to teach customer service skills to the healthcare industry without first addressing the body language cues that commonly occur, or more importantly, should occur, between staff and patient? So what are the most important body language cues for the healthcare industry? Let's find out. Decoding means to observe what the patient's body language cues mean. By reading a patient's body language cues, we can see if their thoughts support what they're saying. We can also recognize when we need to probe further into their health by asking more questions, or whether their body language suggests confidence in what they are saying. First, let's examine some patient body cues you should observe. Let's start with a patient expressing doubt. Notice how this man is touching his eyebrow while he speaks. This body language cue, used in conjunction with the other body cues, is a good indicator that the patient is being doubtful or deceptive with what he or she is saying. When the eyebrow touched is used in conjunction with avoiding eye contact or looking away, more questions need to be asked. Probing questions could uncover additional symptoms necessary to make the most accurate diagnosis. First, on our list of encoding body cues is the voice of enthusiasm. Let's turn our attention to Sue, the receptionist. Sue is a patient's worst nightmare. Remember that a patient has made an appointment because they have an issue with their health. Pretty obvious. The patient may not be feeling well, or they could be in a lot of pain. Voice tone alone accounts for 38% of all communication. Sue sees the patient as a bother, and her voice tone reveals it. Notice how she justifies her behavior.
You know, Sue, you could try to be a little nicer. I mean, to the patients, you know?
Nicer? You want me to be nicer? You know what, Rachel? This place has to run like a business. Do you know why? Because it is a business. And Dr. Walker depends on me to make sure that it continues to run like a well-oiled machine. I can't do that by being nicer. Nice is your job, so why don't you go on to the back, find somebody to be nice to, and leave me be. Let me be efficient and get things done.
Every healthcare facility must run efficiently, but Sue has overlooked an important aspect. Other than setting the appointment, the receptionist is one of the first points of contact between the healthcare provider and the patient. Fully appreciating that the goal is to put those that you care for on the road to better health, that road begins with the receptionist. On the other hand, let's examine an example of proper voice tone. Notice how Dr. Gordon uses a positive voice tone and how the patient responds.
How are you doing today, Miss Stevenson?
I'm doing well. My husband just got a promotion.
Really? That's terrific. What's going on?
Well, he's been with this company for about 10 years, and this is the third promotion he's had since.
Wow. Well, you must be really proud of him.
Oh, yes.
Well, congratulations. I think that's terrific. Now, let's get back to the stitch and see what's going on with that, shall we?
Okay.
Next on our list of body cues is facing the patient. Facing the patient directly indicates that you recognize and value them. Every patient wants to be acknowledged. By initially facing them, your patient will feel a greater sense of appreciation and will likely return for additional patient care. Key body language cues, including critical information from the patient, can be missed. Remember, facing the patient says, "I acknowledge you." A healthcare facility is a business. However, while dealing with increasing patient loads, many healthcare providers and their staff become rushed. They develop into good time managers and forget to provide a healing environment for those who visit their facility. On the other hand, a positive bedside manner plays a major role in the healing process, as well as building loyalty from those you treat. Observing the correct body cues, therefore, must become a necessary discipline. A discipline that aids in the correct diagnosis, creates an environment that fosters the healing process, and, perhaps most importantly, becomes a critical ingredient in building and maintaining a successful practice. Also, keep in mind that people who have a strong personal interest in their healthcare providers are far less likely to pursue malpractice. The body language cues covered in this program are simple and easy to use. With a small amount of effort, you can grow to be familiar with each gesture. Apply each body cue in conversations with friends and family, and see how effective you can become. When you receive the correct response 4 out of 5 times, move on to the next body cue. After a while, you'll find yourself using a number of body cues simultaneously. Share this information with members of your staff and build a practice where everyone successfully displays the type of behavior that creates the finest healthcare possible. In our next episode, we'll discuss more encoding and decoding body language cues to achieve greater patient care. Thanks so much for joining us. We'll see you next time.